So our next live question is, Dr. Vanderbilt, what is the best material for bone grafting and dental procedures, and what factors should be considered when choosing the material?
There are so many materials available for the dental bone grafting. If you think about the brand names, I'm not going to get into the detail. The material that we are available are, we call it as an autogenous bone graft, which means like it comes from your own body, or like a non-autogenous, which means like it comes from somewhere else. So on the non-autogenous, which means it can come from either from cadavers, we call it as an allograft, or we call it the one that comes from either the cow or from the horses, we call it as the xenograft. Sorry, the cow is called like equine graft. The cow bone is called the xenograft. And then we also have some synthetic materials. It always happens in our office, right? Whenever I come for a live show, I come up with something like I'm really bringing something fresh. This afternoon, I was in my Dallas office. The patient has some strong religious beliefs, and he cannot get any type of an allograft, which means it comes from the cadaver, or like a xenograft, which comes from the cows. So he was asking for some synthetic material. So I had to use a synthetic material for this particular patient. So going back to your answer, what type of bone grafting is the best? So depending on the situation, we end up using a different type of bone graft, and then depending on the type of defect, we will end up using a different type of bone graft, and depending on what your dentist believes in. So the dentist may not be comfortable with using a different type of bone graft, and they are trained in a certain type of bone graft, and depending on the region that you are in, depending on the country that you live in, one bone graft may be popular than the other. And then this is what we study in medicine, and we kind of like as surgeons, and we use a lot of bone graft as compared to the dentist. And so in the meetings that we talk, like, hey man, what's your cocktail? Right? So cocktail, man, we are not talking about drinking here. We are talking about, hey, what do you put in your bone graft? Hey, do you use the allograft, or you mix it with the xenograft, or you mix it with some synthetic material, or you add some antibiotic to it, or you add some growth factor to it. So simple answer to your question, there is no such thing as what is the best for your what is the best bone graft. It really depends on your condition, depends on your surgeon, depending on the place that you are in. So multifactorial question. So talk to your dentist or your periodontist or your surgeon. They should be able to answer your questions for you.